Colon cancer used to be considered a disease of older adults, but over the years, doctors are beginning to notice something worrying. People under 50 are being diagnosed. The challenge is that common symptoms are often being ignored or even mistaken for common digestive problems. In this video, I'll be walking you through the early warning signs of colon cancer in younger adults, when to see a doctor, and why early detection matters. Welcome to the Bar Chronicles. I'm Chidera, a pre-assessment nurse for endoscopy. And if it's your first time to encounter this channel, please don't forget to like, share, and subscribe to this channel, as I always look forward to bringing you in-depth insight on how to better manage your bowel and what to experience when going for your diagnostic investigations for your bowels. In many countries, routine colon cancer screening traditionally starts at age 50, but doctors are beginning to see increased cases in people in their early 30s and 40s. The good news is that when bowel cancer is detected early, the treatment is more effective and less invasive. But early detection starts with recognizing the symptoms. One of the most common early warning signs is persistent change in bowel habits. This could include diarrhea that doesn't go away, constipation that lasts for weeks. When you experience periods of diarrhea alternating with constipation, occasional changes happens in most people, but when these changes last for weeks and does not subside at all, then you should consider seeing your doctor. Another important symptoms to look out for is blood in your stool. It may appear as dark red, bright red, blood in your stool on wiping, or even stool mixed with blood. People assume it to be hemorrhoids. However, if this bleeding is persistent and worrisome, then you may consider seeing your healthcare professional. Another sign that people do not connect with bowel health is unusual fatigue. Slow bleeding in your bowel would lead to what we call iron deficiency anemia, which results in you feeling tired, weak, or even resulting in shortness of breath. So if you've been experiencing unusual fatigue over a period of time, it is worth you seeing your healthcare professional. Also, if you're experiencing weight loss when you're not trying, which is called unintentional weight loss, especially when it is linked with some bowel symptoms, it may be worth it also seeking medical advice urgently. Long-lasting abdominal pain, cramps, or bloating, which does not subside over a period of time, is worth investigating. While these symptoms might often be seen as benign, it is also important that if they do not subside over a period of time, you seek urgent medical interventions. Some patients describe the feeling like they want to empty their bowels shortly after going to the toilet. This sensation of incomplete emptying the bowel could signal more severe bowel health conditions. Many younger people delay seeking for medical attention because they assume that I'm still very young to develop bowel cancer. It's probably IBS or even stress or my diet. But persistent symptoms should never be ignored at all. If you've decided to seek medical attention, your doctor could recommend some tests for you. These tests could include routine blood tests, CT scans, or even a colonoscopy or flexible sigmoidoscopy to investigate your bowel. You could check out my videos where I discussed about what to expect for your colonoscopy and flexible sigmoidoscopy. The good news in all of this is that the earlier bowel cancer is detected, the more effective and less invasive your treatment plan becomes. During a routine check, polyps could be identified in your bowel and removed. This would have in the future turned into cancer, and that is why we advocate for routine bowel cancer screening checks. So in summary, you should speak to your healthcare professionals if you notice any of the symptoms: persistent change in bowel habits, blood in your stool, unexplained fatigue and anemia, unexplained weight loss, constant or persistent abdominal pain. All of these symptoms should not be ignored. Rise and speak to your doctors urgently so they can initiate the necessary tests for you, because early detection results to better outcomes. Our body often emits signals to tell us that something isn't right. So if you're having these signals or the signs and symptoms, please do not ignore them. Quickly speak to your healthcare professionals so they can arrange the necessary tests for you. So if you found this video interesting, please do not forget to like, share, and subscribe to this channel, as I look forward to bringing in more in-depth information on how to better manage your bowel health. Until I see you in my next video, keep taking care of yourself.